Good afternoon. We have with us Dr. Vinod Kumar Singh, critical care specialist from Sir Gangaram Hospital, New Delhi. We welcome you to Natco Pharma Specialty Criticon studio. And we look forward to listening to you, to your advice, in particular for the younger generation of doctors in the space of critical care, as well as those associated with antibacterial resistance. My first question to you, doctor, is how do you foresee the changes in critical care management?
Yeah, I'm here in critical care since last almost 25 years. And I have seen how the critical care has developed. And because now more and more younger people are interested in coming to the critical care, their management plan and how to basically, if you talk about the specific things, the antibiotics uses in the critical care, they are now focusing on how to minimize the development of drug resistance, and which is the major cause of concern in the critical care area. And also, new generation is more and more interested in using the new technology for the critical care management. So as the time has passed, the critical care has developed as a super specialty, at least in India, and people are more interested in coming to critical care.
So that's 25 years of experience that you're sharing with us. Lovely. What is your advice to the young ICU doctors to enhance patient care?
Yeah, what we have learned in critical care is that we have to be patient focused. That is the very, very important, because so much technology and so much information nowadays in every field and every part of the critical care. We have to be focused to the patient. What are the things is going to benefit to my patient? Okay, that is one. And second, for all the youngster, my advice is that to be up to date when we are working, because things changes very fast in critical care, and critical care dynamics are different from the other medicine, which is not so much related to the high risk of death. So be patient focused and remain up to date in cases of critical care, and develop a passion for the critical care, that what we started in the critical care. And now my advice to the people that it requires energy, it requires demand from the intensivist to be focusing on the patient and the when we are working.
So I love that the patient focus is, your biggest input, and the second input you're sharing is be up to date. So that's valuable again. The third question is, what is the prevalence of carbapenemus producing bacteria in your specialty, in your practice, and what is the best treatment option?
See, I tell you, I'm working in a tertiary care hospital, which is a large hospital and teaching hospital. So the situation in almost all tertiary care hospital, which is a large, more than 600 bedded hospital, patients are coming from the different areas. There is a very high prevalence of carbapenemus infections. Almost all gram-negative infections we are getting, they are almost 80% are resistant to the carbapenem producing resistance and carbapenem resistance. So one is that once the patient, we are trying to choose the antibiotic for such patients, we have very limited options. Like you are going for some type of colostrum or colons, or you are going for some other antibiotic also. Very few, they are very few. Like if you are using a Klebsiella and other things, you can go for fosfomycin. Or even if you are going for a combination of the ceftazidime and the ivibactam combinations, we are going for that. So these are the very limited options for those patients who are carbapenem resistant organisms.
With us was Dr. Vinod Kumar Singh sharing his 25 years of experience, and we thank you and wish you all the best. Thank you for spending time in the studio.